as the entire symposium, of course, has been. We are so fortunate to have such amazing speakers that have dedicated their time to studying Parkinson's disease, to teaching Parkinson's disease, and to taking care of patients with Parkinson's disease. Everyone that has been a speaker today, they have the exact same passion for Parkinson's disease as I do, and I thank them for blessing me with that as well. Our next session is going to be impact of therapy, exercise, and nutrition, and we're going to have some case studies. The 4 speakers are part of our comprehensive team on the Parkinson's team. Jennifer, Ann, Vicky, and Jenna, it's all yours.
Good afternoon. My name is Jennifer. I'm a physical therapist at Nebraska Medicine.
And my name is Mahnke, and I'm an occupational therapist also at Nebraska Medicine.
We're getting hand signals that you can't hear us. Is that better? Okay.
No? You can be louder.
This?
Sure.
Hello? All right. I have the privilege to share with you this afternoon a case study of an individual that we've seen in our outpatient clinic that has Parkinson's, and we will be, I'm okay with this. Yeah. Mm-hmm. We're good. Thank you. So we are going to show a little bit about how therapy can be effective in treating the symptoms of Parkinson's disease. I need more hands. Okay, so therapy is going to aim to focus on large amplitude movements at a high intensity to increase dopamine output and counteract symptoms of rigidity, bradykinesia, and tremor. Overall, we really encourage exercise. Exercise is like medicine when treating Parkinson's. So any form of exercise that you like to do, we encourage you to participate in regular physical activity. However, today we're going to talk about 2 specific programs designed for Parkinson's disease. One is called LSVT BIG, and the other is Parkinson's Wellness Recovery, or POWER. So physical therapy aims to develop, maintain, and restore maximum movement and functional ability throughout the lifespan. Physical therapists will work with individuals who have movement impairment or change in their functional ability due to age, injury, disease, or disorders. Goals of physical therapy are to promote quality of life and independence by encouraging activity and maximizing functional mobility, promote safety and fall prevention, and improve movement for daily activities by recalibrating the body through large amplitude movements. Improve walking by incorporating large movement patterns and using internal and external cues.
So for occupational therapy, we typically focus on the things that you need to do to take care of yourself every day, whether that's getting dressed, buttoning zippers, reaching down towards your feet for putting on socks or shoes. Any fine motor task that you might need for home, like handwriting or at work with typing. And then general mobility for those self-cares, so getting in and out of bed, on and off of a toilet, or any type of bending or twisting that you might need for bathing, cooking, or any laundry tasks. Overall, the goals for occupational therapy are to increase independence with your self-cares through the use of restoring your movement or some adaptive techniques if needed. We'll provide education to whoever your caregiver might be, and then also educating on those high amplitude movements and helping you learn how to incorporate those into your daily routine to make things easier. Overall, we want to work on improving your coordination and strength for dressing, bathing, cooking, any leisure activities, or any work-related tasks that you need to do. So now I'm going to introduce you to our case study. He is a 52-year-old male who was diagnosed with Parkinson's this year. He had some comorbidities or a history of a severe left ankle sprain where he had a repeat injury fall. He has a history of frequent right knee dislocations and osteoarthritis that caused him a lot of knee pain. He was taking medication for Parkinson's. He was on ropinirole 1 milligram 3 times a day that he took at breakfast, lunch, and dinner. And his symptoms related to Parkinson's were those slow movements in his right hand, tremor in his right hand that would come and go, and that led to a decrease in his fine motor coordination at work. He had that persistent right knee pain, decreased right knee motion that caused a shuffling pattern in his gait, and then he had an absent right arm swing while he was walking, and all of those things led to impaired balance. It is important to know also that our client works full-time still. He enjoys bowling during the winter and riding bikes with his kids.
When he came to physical therapy, he was complaining of the tendency to shuffle his feet, difficulty on stairs. I feel like I'm echoing. Stiffness after sitting for a long time, and losing balance easily, as well as slowness on the right side. His goal in physical therapy was to walk normally again, or feel more fluid in his movements.
So for occupational therapy, the things that our client wanted to work on were shaving, donning and buttoning a shirt, putting on compression socks, and then typing at work. It was to the point where he was having a hard time making it to work on time because it was taking so long to get ready each morning. And his goals were that he wanted to improve his writing, his typing, and daily living tasks, and he wanted to see improvement without increasing his medications.
We introduced him to the LSVT BIG exercise program, and as we go through these slides, you'll see the series of maximum daily exercises that are done. This first one, floor to ceiling, incorporates a large movement, reach forward, down to the ground, up to the ceiling, and then holding that posture for 10 counts and repeated 8 times. So really emphasizing tall posture, big movements at large amplitude. The second one incorporates a side-to-side movement. It's done to the right as well as to the left, so incorporating a little bit more rotation for this exercise, which is not playing. We're having a little technical difficulties this morning with our slides. There we go. So reaching across the body, so getting more trunk rotation, again, really emphasizing a reach and stretch all the way out through the fingertips, tall posture, big movements, and with all of these really working at full effort, 10 out of 10 energy, strength, really giving it your all. The third exercise is now done in standing, and it's forward stepping, so a little bit more dynamic, which starts to challenge the balance. Reaching forward with the step, coming back into place, doing that with either foot, leading for 8 repetitions.
Start big, step forward big, and big. Good.
Okay, and then we do a sideways step and reach. So more lateral movement, stepping to the side, reaching those arms, tall posture, full energy, doing that each direction 8 times. So again, through all of these, we could incorporate challenges to the balance by stepping onto foam or changing the surface or adding weights. It really depends on what each individual needs to make the exercise fit their ability levels. So we can do them in sitting, we can do them lying down, or in standing and sitting like these videos show today.
Back big. Nice.
Backward step and reach.
Big. Step
Like you can see, stepping back, bending over, very dynamic, challenging balance, posture, stepping. This is done with either foot as well. Lots of symmetry, incorporating both sides of the body. And rock and reach. The foot's position is staggered. The arms are reaching up and down, alternating, working on good large amplitude movement, reciprocal movement. It's what we need when we walk, is that arm swing, the leg movement. And this is done for 10 counts, either foot staggered forward. Just big, tall postures. Sideways rock and reach incorporates twisting motion through the trunk, turning the head. So really the whole body is involved, getting the head, the trunk, the arms, the legs, the feet. Just lots of motion, large amplitude again, tall posture, working full effort.
Start big, twist big, and big. Good. Reach big.
Okay, sit to stand. 5 repetitions, really working on momentum to get up from a chair. That's often a very common complaint that I hear in the clinic is it's really hard to get up from maybe the toilet or a chair or the couch. And so really working on forward momentum, getting your weight shift forward, getting onto your feet safely. That's done 5 times. And in therapy, we incorporate a lot of other functional tasks as well. It depends, again, on what each individual needs and what their difficulties are, that we develop exercises to work on improving those tasks. The other part of the LSVT BIG program is big walking. And so we'll show some video here of walking before we work on gait strategies. And you can see, I don't know if that can be played again. You can see it on that slide. There's lack of arm swing, and that was one thing that we talked about at the beginning. Reduced arm swing. He's not swinging the right arm really at all, not much on the left, and that right foot's really dragging and sliding with decreased foot clearance. And that was some of the things we talked about at the beginning, that those were some of the difficulties he was experiencing, and some of his goals was to improve that fluidity of his walking and walk with increased pace and just more safely. So we work on different interventions to improve gait. We teach a lot of internal and external cueing, so using your own voice in your head to tell yourself to step bigger or to take a longer step or step right or step left. A lot of times external cues, tape on the floor or laser lights or music, a metronome, anything to give an external auditory or visual stimuli to help improve the quality of gait, and working on big movements and increased safety. Freezing is very common with an individual with Parkinson's, and so they get to where they can't move their feet, or they're shuffling and they're stuck. So we teach to stop, shift your weight, and then step big. So kind of 3 S's, and using that rhythm or weight shifts, music, that's when those external cues are very helpful to help a person to start to move more freely again and reduce their fall risk. So as we continued through our sessions, you can now see such improvement in his arm swing. That right arm is swinging, that left arm is swinging. He's in a good sequence. He's taking big steps. He's picking up that right foot. He's just much safer and he's more fluid. He's going to keep up with those kids and just enjoy being able to walk freely in his community. When we started therapy, there's a gait assessment that I perform, and it's called the functional gait assessment. Some of you who've been in therapy have maybe had that, but he scored 23 out of 30, which is a lower score. It shows an increased risk for falls. And midway through our therapy, he scored 27 out of 30, so good improvement. And by the end of therapy, he scored 29 out of 30. So really reduced fall risk, shows much improved safety for community ambulation, and just that he can go about and do the things that he wants to do.
Great, same thing again. Even bigger. 1, 2, 3.
So I'm going to talk to you a little bit about the Parkinson's Wellness Recovery Program, or POWER. You can kind of see, and Sherry Prince did a great job of doing some of those moves with you guys just before we came up here. And so you're probably familiar with some of them, but some of the main movements are similar to what you would see in LSVT BIG. And the movements are rock, up, twist, and step. So I'll show you some of those today. This first one was the seated position of the rocking, which really works on weight shifting. And then this next one we also did in a seated position, and it's the power up move, which is more focused on posture and kind of counteracting that symptom of that forward rounding posture that you see so often with Parkinson's. And again, just like with LSVT BIG, we're focusing on high intensity movements. So as Jen was saying, I'm having people report, 7, 8, 9, 10 out of 10 effort level during our sessions. And that might look different for every person. Next, we did a seated version of the twisting motion that focuses on the rotation and cross body patterns that you would need for reaching tasks. And as we go through these movements, we're emphasizing, high intensity down to every piece of our body, including all the way down to our fingers. So a way that we increased the intensity for our client was to get him in an all-fours position, and we also added some wrist weights for him, just to, like I said, increase that intensity, but still working on the same posture. And then we did the all-fours position for a twisting, and again, working on that rotation with those wrist weights at a high intensity, all the way down to a finger flick with each movement.
Forward again.
Okay, so next we did a rocking.
Perfect.
This one also working on posture, but that weight shifting again. Some things to be cautious of throughout our session. We're managing, low back pain. Not everybody would be able to tolerate this particular position, but we can do these things in a laying down position, seated, standing, however needs to be done. And one thing that I really like to emphasize with my clients is focused finger flicks. So this is something that can be incorporated throughout someone's workday. So for this particular client, he was having trouble with the tremor and with the slowed movements in his hands that were making it hard to type and write. So this is an easy exercise that can be done while sitting at a desk during the day, and really emphasizes that focused movement, the high intensity, but down to your hands. So his goal was to get ready for work faster. He was, again, to the point where he was having a hard time making it to work on time. And so he wanted to work on getting on and buttoning a shirt. So he has a hard time with some of the buttons. And this particular video was taken at the very beginning of one of our sessions. And so you can see he does okay here and then starts to struggle a little bit on the cuff buttons. And just it overall taking a little bit longer than he would like it to. So that was 1 minute and 14 seconds to put it on at the beginning of our session. And then we did those high intensity exercises and then those focused finger flick exercises. And he was able to incorporate those concepts of doing a big effort applied to these small movements. And he was able to do the same task in 30 seconds faster. So incorporating these things throughout the morning routine can add up to, an easier time getting ready for work. And he was pretty darn determined to do this faster. Good. And that last one went a lot easier for him.
Good.
So lastly, I want to talk to you guys about when is a good time to get a referral from your provider for physical or occupational therapy. And the best time would be a new diagnosis of Parkinson's or Parkinsonism. And that's so that you can learn these exercises and learn the appropriate techniques in order to maintain your function. As Jen was saying, there's so much evidence behind exercise as a piece of medicine for people with Parkinson's. So again, doing these things early is going to lead to prolonged function. Later on down the line, if you're having trouble with decreased mobility or having a harder time completing your self-cares or just moving around, then that would be another time to ask for a referral. So a big part of what we do is work as a multidisciplinary team. So I'm going to bring up our speech therapist and our dietitian to talk to you next.
Hi everyone, I'm Vicki. I'm the speech therapist. I actually work through UNMC, through the Monroe Meyer Institute.
And my name is Jenna. I am the dietitian or nutrition therapist, actually solely with our neurology department and our neurology clinics. So I'm part of our Parkinson's multidisciplinary team.
All right, so we'll start with, I'm a speech language pathologist. I work with a variety of different disorders, including speech, language, cognitive, voice, and swallowing. However, particular to Parkinson's disease, I mainly work with your voice and your swallowing.
And then as a nutrition therapist, I am working to diagnose and manage any nutritional issue that comes up related to a particular medical condition. So specifically with Parkinson's, we'll talk about nutrition issues here in a few seconds. And then a big part of what I do is providing like counseling and education to people on how can we make some of those diet changes or nutrition changes to ultimately help improve your quality of life or help with managing some of those symptoms with Parkinson's.
So we'll talk about our case study. His name's Mr. C. He is a 46-year-old male who lives at home with his wife and his daughter. He attended the multidisciplinary Parkinson's disease they have at UNMC back in July of 2019. He was diagnosed with Parkinson's disease in 2018. His first symptoms were hand tremors, leg tremors, and swallowing difficulties. His current medications he was taking for Parkinson's disease is that carbidopa, levodopa, 1 tab 3 times a day, with already sensing that it was wearing off after about 4 to 5 hours. And he also had a rotodagine patch. My goodness. So in the Parkinson's disease clinic, if you were to come to it, when you meet with the speech pathologist, we do 2 types of evaluations. We work with your voice and your swallow evaluation. The first one I'll touch on is that voice evaluation. The first thing you're gonna do for us is complete a voice handicap index. That is kind of a self-assessment. How does your voice impact your life? How do you perceive it? We also do what's called a maximum phonation time. Mr. C averaged 4.6 seconds, so that's just holding out his voice as long as he can for 4.5 seconds. A normal person, they can hold it for 15 seconds. So he was judged to have a mild dysphonia, or that's just the big fancy term for a voice disorder, characterized by reduced intensity and monotone quality. That's typically what I see in people with Parkinson's disease, is really soft voices and not a lot of pitch variation. You become very monotone. And so we had recommended that LSVT voice program, which is kind of a sibling to the big program that Jen was talking about. So the LSVT program, what it does is it trains you to use your voice at a normal loudness level. What Parkinson's disease does is changes your sensory input. So it's kind of hard to get people to buy into this program because they come to me and they're like, Vic, I feel like I'm talking plenty loud, but you're not. Parkinson's changes how you sense how loud you are. So you will feel like during this program that you're shouting and just talking so loud, but its point is to recalibrate you to use a new loudness. The program consists of 16 sessions across 4 weeks. We do both structured tasks, trigger tasks, and we monitor your volume and conversation. The trigger tasks are actually kind of fun. When you come in for an assessment, I give you a handout. It's 10 things you say every single day. And what we do is we work on those every single day in therapy, and those are meant to be your light bulb, that in the morning, when I say good morning, I need to use that trained, loud volume every single time I say this. It's kind of that, like I said, that light bulb or that trigger to use that voice outside of therapy. So the 3 structured tasks we do during the LSVT program, the first one is just sustained phonation. Mr. C is 4.5 seconds, building it up. The longer we get, the more kind of breath support you have for longer sentences. So just kind of holding out the ah is the sound we work with. So holding out ah as long as you can, as loud as you can. We also work on pitch glides up and down. That helps with that monotone quality that people get with Parkinson's disease, singing both up the scale and down the scale. And then again, we work on those trigger tasks in conversation every single day, kind of an ongoing assessment. I'll come back to that guy. So that's kind of the voice evaluation. We recommended that LSVT program. There's other voice programs out there for Parkinson's disease, but we also look at a swallowing evaluation when you come into that multidisciplinary clinic, Believe it or not, I am a speech therapist. Doing that swallow evaluation, start with that EAT 10. That's just another self-assessment. How does your swallow impact you? How do you feel about it? What's bothering you? So going back to Mr. C's swallowing issues, this is what we picked up. He says it takes him extra effort to swallow. He feels that foods, liquids, and meds get stuck. He says he had 2 choking events where he required the Heimlich to clear the material, and he states sometimes that he even has to chew up a piece of toast, put the pill in the toast, and then swallow the pill in order to get those pills down. So he completed that EAT 10. That's where we kind of got what's bothering him with the swallowing. He also underwent a clinical swallow evaluation where we're just going to give you some different consistencies to eat and drink. What's giving you more trouble? Are you having any really overt signs of things going down the wrong way? Coughing, choking, sometimes your voice will get wet and gurgly. So he underwent that, and he was found to have a mild to moderate dysphagia suspected. I say suspected because our clinical swallow evaluation is pretty limited. We just get to take really educated hypotheses. We don't really know what's going on until we can do that further or that formal assessment. So that's what we had recommended. The 2 types of further or formal assessments, the first one's a modified barium swallow study, where we get to take a moving x-ray of your swallow. We give you things to eat and drink that have barium in it, and that's what lights up in the x-ray. The other one we can do is called the fiber optic endoscopic evaluation of swallow, and that's where we actually take a camera, we put it up your nose, and we get to kind of take a top-down picture of your swallow. These are 2 pictures of those studies. The first one on the left is that modified barium swallow or that x-ray swallow study. And the one on the right is the one with the camera through the nose. Just 2 different pictures. Both give us great amount of information. We can really tell us what's going on in the swallow. So it can tell us if you have deficits in various stages of your swallowing. There's 3 big stages when you eat and drink. It tells us if we need to modify your diet. Do we need to thicken your liquids or soften your foods? Do we need to implement various strategies? Sometimes we'll have you tuck your chin, or sometimes we'll have you take a deep breath and hold it when you swallow. And it also tells us if we need to initiate one of those exercise programs. A couple basic swallowing exercises that I like to do. Kind of hard to, just give these to you guys and say this is gonna fix you because everyone's swallow is different. It's hard to determine what's really going on. But these are probably the 3 main ones I work with. The first one's called the Paseka maneuver, named after the scientist who discovered it. What it is kind of a tongue hold and swallow. So all you do is you stick your tongue out, you hold it in place either with your teeth, your gums, or your lips, and you swallow as you hold your tongue in place. Pretty difficult to do, but the more you do it, the easier it gets, and it's actually the best one for you. You get the most bang for your buck from it. Another exercise we have you do is harder and effortful swallow, where you swallow normal, and the fact that you don't have to stick your tongue out to swallow, but you have to imagine swallowing either a hard-boiled egg or a cotton ball, just really putting in that resistance piece in yourself. As I can't add weights to your throat, I can't add weights like they did on your wrists. You kind of have to put in that extra effort yourself. And then the last one is the supraglottic swallow. He kind of helps with the coordination of breathing and swallowing, because when you swallow, you cut off your airway, you stop breathing for a split second. So this kind of helps with that coordination piece. So it's really just taking in a deep breath, holding your breath, swallow as you hold your breath, and then coughing immediately after.
All right, and we'll jump over to Mr. C's nutritional issues. So when we saw him in clinic, he reported a few things to me as some concerns. So one of them being he had gained 10 pounds over the last 6 to 8 months, so above what his normal weight had been ranging around. He said he's been experiencing some nausea, likely related to the carbidopa-levodopa he was taking, because that started when he had started the medication. He said that he wasn't able to taste foods as well as he used to. And then his smell also had been impacted. So that olfaction, I think some of the physicians talked about this morning, is sometimes one of those changes that occurs even before you have your motor symptoms. So he said he didn't have a very good sense of smell anymore. So those are the things he was reporting to me, or those issues going on. But really, we had to think about what is leading to those things. So the nausea, the taste changes, smell changes, that was related to some of the Parkinson's disease development and then medications. But then the weight gain. So, further questioning led to him telling me that he was having to eat more throughout the day to help combat the nausea he was experiencing. So he's like, I had to keep something in my stomach more often throughout the day to help make me feel better. So he was eating more calories, and that was leading to him likely gaining some weight. So we're always, the patients always tell me things, and I'm going to be the detective to try and find out what it is so we can address that problem to hopefully help fix some of these issues. So as I was talking to him more, he was telling me about what he usually eats throughout the day. So he said on an average day in the breakfast, he'll have 2 slices of toast and put some peanut butter on it. For a snack in the morning, he'd have an avocado with crackers. For lunch, he was still working, but he would usually go out to eat for his meal. So he was having like a Mexican meal from a restaurant. In the afternoon, he'd have some trail mix. In the evening, he'd fix up some chicken and vegetables in a salad. In the evening, he'd have some cheese sticks. And then for his fluids he was drinking, he was having water and Diet Coke. We're probably split 50-50. He was having some iced tea and then would have some vitamin water. So not only am I looking at the foods he's eating, but also hydration too. So when we look at his meals, there's a fair amount of some good healthy foods in there. He's mentioned vegetables a few times. He has some peanut butter with some healthy fats and the avocado with some healthy fats. Cheese sticks, he's getting some protein, he's getting some fat, he's getting some carbohydrates. The hard thing though is I'm not sitting there eating with him, so we also talked about portion sizes, like how much of these things are you eating? So as we talked about recommendations, actually I'm going to come back to this. One of the things we talked about was just portion sizes. That, for example, in the morning, instead of having a whole avocado with crackers, let's have half of an avocado. That's probably a more appropriate serving. And especially since he was eating more often throughout the day, he could cut back on the portions at his meals because he was having those snacks too that were also providing some calories for him. When we focused on the foods he was eating, so some people ask me, what diet should I eat for my Parkinson's? What's going to, what specific diet? There's not necessarily a specific diet that's recommended for Parkinson's. Really, it's truly, a well-balanced diet. But that Mediterranean diet approach probably has the best concepts of the foods that's included in the Mediterranean diet that has been linked to being possibly helpful in Parkinson's disease. So the very first thing there I've listed is fresh fruits and vegetables. This is probably one of the best things that you can do is increase your fruit and vegetable intake. There's different vitamins, minerals, antioxidants, those helpful nutrients that can be possibly brain protective. It's hard when, we all know, I didn't have to tell you, oh, we should eat more fruits and vegetables. We've all been told that, we all know that. The hard thing is like, how do we go about doing that? So that's what I try to work with each individual patient is tell me the things you like and how can we fit that into what your day looks like? Or how can we have you maybe try new